All right. We are recording. Welcome back to the 2025 Borealis Psychedelic Science Summit in Stockholm. My name is Yoshi and I am joined by Dr. Ivana Lopez.
Yes.
Welcome.
Thank you so much. Thank you for having me.
Thank you for being here. I've said that phrase a few times now. The Borealis Psychedelic Science Summit in Stockholm. There's a lot of S's going on.
Yeah,
there.
I've just said Borealis.
Borealis. Yeah.
Yeah.
See, you're smarter than I am. That's the doctor part.
That's the doctor part. Could be.
So we're almost through day one. How has your experience of the conference been so far?
Oh wow, it's been like I mentioned before. It's been a mix of all amazing kind of subjects. It's been all from people talking about like Julie Holland's her keynote opening speech was very much like diving into her experience and where she comes from and what she finds interesting and then coming over to our challenges and what we as a research community need to are facing and the challenges that we face and that we need to like try to answer as good as we can.
Yeah, there's a lot of interesting talks. It's hard to know where to turn your head, it seems.
Yeah.
Too much going on at the same time.
Yeah, isn't that the best? But also it's just amazing to meet these people.
Yeah, for sure.
And meet the faces behind the papers.
Yeah, definitely. Yeah. Tell me a little bit about your background and how you got to work with psychedelic research.
Okay, so now I'm a medical doctor, and right now I'm working full-time with the CAPSI project at Karolinska Institutet. And that's also a fun story. So I became interested in the field when I was in my 7th semester during med school.
Right.
And it was because I was listening to a podcast from Sam Harris where he was talking about psychedelic research. And I didn't know anything about it before that. And I was very like anti all kinds of drugs. Like I didn't want to know anything about it. And especially not hearing that it could be good in some cases. But I really respected Sam, and I started to listen, and I started to read, and I read like articles, and I thought I understood it all, and I was like, wow, I need to know more. Yeah. And I reached out to researchers, and I wrote to Gerhard Gründe, who's here today. And I was like in semester 7. I was like, hi, I'm a med student and I'm really interested. Could I come and do like an internship? And he was a few like in my early like psychedelic research interest days. He responded and he was very kind and encouraging. Unfortunately, that didn't work out with my schedule. So I didn't go. But that like started the process of this curiosity, wanting to know more, wanting to be a part of the research. I remember I was feeling like, because back then PSIPET was going on in Sweden, the pilot study with psilocybin. And I was feeling like, oh, I need to be there. I want to be a doctor already so I can be in that study and help. And and I want to answer these questions and I want to be in that trial. And I wrote to Johan, who's now my supervisor.
Johan Eriksson?
No, Johan Lundberg. Yeah. And also Maria Beckman, who's like a part of the crew. And most of them, they didn't respond. I wrote to the whole group. I wrote to everyone. But what I didn't realize back then was like I was planting seeds. Yeah. Because years later, so that didn't work out because I was a med student. They didn't need anyone at that time. But I was also doing like, I was very interested in like the mind and meditation and like the science behind it, but also like philosophy about it. So I studied a course, it was like some kind of philosophy. I'm not recalling the exact name now, but like philosophy of the mind kind of. And then also a neuroscience course with about the brain. And there I got in contact with a researcher, a preclinical researcher in Uppsala. And I asked him, like, I'm interested in this field. Like, I would like to start doing some kind of research. Mm-hmm. And he was like, well, we don't have any psilocybin research going on now, but we do have a chemist who's involved in those studies, and I guess he could synthesize some psilocybin for you, and we have some extra rats. Would you like to do some work with us? And I was like, wow, an opportunity. Like, yeah. I think I was vegan at the time, and I was like, I needed to go to this animal research course and like kill an animal, you know? Mm. But that was a great experience to do that that process. Mm-hmm. Like, and then I also realized that I don't want to work with animals like this. Like, right. Preclinical research is so valuable, and we need that for the full picture. But it was not for me. I was more interested to work with humans. Yeah. But that was amazing. And the chemist that I got in contact with was actually Ulf Bremberg.
Okay.
Who's...
Yeah, he's here today as well.
He's here today. And he was the one who said, like, you know what, you should get in contact with Robert, because he might be starting a psilocybin... I'm not sure I said that, but, you know, it might, like, get in contact with him. Yeah. And then I did my master's with him.
Oh, nice.
But with an RTMS project. So nothing with psilocybin, because CAPC hadn't started yet. Mm-hmm. But it was like I learned, like, first to just work with that research group and to collaborate, and I liked the process, and then I got the opportunity to work with CAPC.
Cool.
Yeah, and I never thought I would do like a PhD or something, and now I'm here. And you said doctor, and I'm like, am I a doctor? I mean, I have the medical degree, and I guess someday I'll be a doctor or something. But, you know, like, I never thought I would go on this path. But it's just so great because I have this passion for it, and I feel passionate, and I feel curious.
That's awesome.
Yeah.
That's even better. It's just your curiosity and your passion that took you down a road that you didn't expect, and now you're looking at being a doctor in what you're passionate about. Yeah, that's super cool.
Yeah,
that's awesome. So is that the work you're doing right now? The what did you say it was called? CIPRI?
CAPC. So it's Ca is for cancer patients, and C is psilocybin.
Okay.
So it's psilocybin treatment for cancer-related depression.
Okay, cancer-related depression. Okay, so that is what you're working on currently?
Yeah, so I'm one of the study physicians in the study, and it's a multi-center study.
All right.
And we're going to include 100 participants. Mm-hmm. So I'm both kind of coordinating the study, recruiting participants, recruiting and screening them, and making sure all the data gets where it's supposed to be. Follow up the participants, and you know, it's a whole machinery, and especially at KI we have, so not for all study sites, but for 2 of them, Uppsala and Stockholm, we have quite extensive brain imaging. So like full days for the participants, which is quite a lot for cancer patients. You know? But it's what we're able to do. We're able to do PET, like to look at synaptic density with radioligand. That's quite hyped right now, actually. But we haven't really seen. So it's quite hyped, and so it's cool that we can use that and measure kind of synaptic density, and also MR and MEG and EEG to really get the full brain picture of these participants. Yeah.
How far along is the study?
So now we've finally reached 1/3.
Okay.
It's been a struggle with recruitment.
I can imagine.
It always is. But, you know, like, these patients, they are out there. Yeah. Like, being depressed while having cancer, it's not a strange thing. It's very common. And we know that. But it is strange, like, sometimes, because I've put so much effort and time, like, speaking to oncologists and clinics and trying to get them to recruit. And some of them, they say, like, well, my patients, they aren't depressed. And maybe that's true, and maybe it's just that they don't have the time, or they don't notice, or they don't ask. But it's been a real struggle to find participants. But now we've changed strategy to find them. So now it's finally working easier.
All right. When are you looking to be publishing? Like, how long time frame for the study is planned?
Yeah, so we're planning now to include until the end of 2026. And then, so it's 6-month follow-up. So then by June, they will complete, like the last participant will have completed.
Okay.
And then we can unblind.
Okay.
But we're preparing already now to like we're not analyzing anything, but we're like pre-scripting everything, writing the code,
right.
making sure that everything is in the right format for the brain imaging and trying to, synchronize everything. So when the day comes, we can just hit enter and then we have the results.
A lot of preparation.
Yes.
Yeah, I bet. Is this what your presentation at the Borealis Summit is going to be about?
Yeah. I do have a poster too about a meta-analysis that we recently published about the control group outcomes in psilocybin trials compared to control group outcomes in SSRIs and esketamine.
Oh.
So that's interesting too.
Can you give us a little rundown?
Well, so, basically, alongside, like with this hype about psychedelics, it's like, wow, we see these enormous effect sizes, right? Like 1, 2, like sizes that we're not used to seeing in psychiatry research. Like usually if you look at just SSRIs, and when I talk about effect size, I mean the size like compared to placebo. How much better does the active group improve? How much more? We don't really see so big numbers in SSRI trials, but in psilocybin trials, we've seen like huge numbers, and it's like, wow, they must be so efficacious. But also with like these questions about unblinding and expectations and all of that, there's been talking about that. Why is it so that we see these effect sizes? But no one has really looked at it like this before. So what we did is we looked at, because maybe, so we actually noticed it from looking at other data, and we were like, is this something we can see in all psilocybin trials, that the control group doesn't improve like as much as they usually do?
Right.
And then we compared how much the control group improves in SSRIs and esketamine trials, and then we saw that it was a significant a difference between the groups. And of course, you can't compare them. It's different trials.
Right.
But in general, you can say that since there's such a low improvement in the control group, if the psilocybin group improves a lot, or just like if it improves, the effect sizes will be much larger.
So if I get it, if I understand correctly, so the improvement in the placebo group is lesser in the psilocybin trials than in the SSRI.
Correct. Yes.
That's interesting.
Yes.
What would it? Why would it be that way? What's the speculation?
Well, so they've talked about it a lot today. So I think it's more exactly what they're saying, that so it's maybe the instant unblinding that many
hard to
know
do blind studies with psychedelics.
Exactly, but the thing is, like, not very few SSRI trials have reported on blinding and expectation, all that. I think only 5% when I looked had report. Yeah, so it's very, very few.
Oh wow!
So that could be an explanation, but I mean there are side effects with SSRIs too.
Of course.
So there's a large unblinding there happening too. But that could be one reason, and of course also with this enormous hype about psilocybin and people have high expectations before,
right.
And if they don't get it, they know that, oh, I'm not getting anything.
Right.
Whereas
since it's so obvious that you didn't get it, then you're upset or sad.
Yeah, like the nocebo effect, kind of. But another hypothesis could be also that since that psilocybin trials would recruit participants that don't really have a good placebo response. Like we can't answer which,
right?
But probably it's the first.
Got it. Interesting. What are some highlights in psychedelic research in general that you're excited about today or moving forward?
So I am interested in how, because there are more trials coming up where they are investigating psilocybin for other things than just depression.
Mm-hmm.
In Lund, for instance, they're looking at anorexia.
Mm-hmm.
In Linköping, I think they have started already with the prolonged grief disorder.
Mm.
That's one, because a part of me is like with this hype, it comes a bit like, oh, psilocybin could it be the answer for everything?
Yeah, the miracle drug.
Exactly, for pain, for all these things. Of course, I don't think that, but it is interesting. It will be interesting to see where and like which aspects of these disorders can be helped, can be improved, or if they are. So that's one part, but also like the questions that we're trying to answer, the more biological questions, like what is happening in the brain, understanding more about that. I will also look more into like subjective experience during the dosing, and how and if that correlates with outcome and that's been done, but we need to know more about that, because again, the question about, is the psychedelic experience necessary,
right?
Or is it important, or could
what do
we
you think?
Wow. I think it's interesting when people talk here about how I mean, there are so many different views on this. Like either it's just how the receptors are activated.
Yeah.
And you could do that being like asleep and not knowing anything. I think, wow. A part of me think, so for me, it's not, I don't think that mystical experiences, like if you see aliens, or if you like, but not, maybe that's not the typical mystical, but like just like strange mystical experiences, entities, or I don't think that per se has to do with like that depression alleviates for a longer time, but maybe more like psychological processes taking place, like emotional breakthrough and those things that can interact, like seeing it as accelerated psychotherapy.
Right.
And when the substances help that process.
Got it.
That's something I'm curious to know more about. And also to try to understand, because we're seeing too, like it's not helping everyone. And we don't really understand why. Sometimes the therapist can be like, I don't know if this person is ready, and maybe, but we have the protocol to stick to, and we're doing, but I mean, if in the future there would be a therapist that would assess, like maybe this person needs 3, 4, 5 sessions, or maybe not now, or this person is much more suitable for this kind of treatment, to kind of like precision psychiatry. But we need so much more data to get there, and knowledge.
That is the tricky part. It's such a subjective experience. Even the same person can have 2 vastly different experiences at 2 different points in their life. So it's not easy to generalize when it comes to these things.
No. And I yesterday, I thought it was very interesting to hear Ian, what's his name?
Probably.
Yeah.
There's an Ian
who talked about his experience. He participated in 2 trials.
Oh, okay.
Yeah.
I didn't catch that, unfortunately.
Okay. Maybe his name was not Ian, but he talked about how he was really craving a specific experience.
Okay.
And how that kind of ruined a bit.
Too big expectations.
Yeah.
And he got something else instead.
But I mean, in the ideal world, we would want to give something that, like, regardless of what you believe or what you think and what you just get better. Like antibiotics, like you can't fight it. Like I just give it to you and you get better.
That would be the ideal world.
Yeah. An expectation, like changing someone's mindset beforehand, it's much more complicated.
Absolutely.
Take much more time.
But that's why research like the kind that you're working on is so important. We're not going to get the answers to these questions until we do enough research. So
Yeah, that's true.
Great work. Keep it up, and I hope the study. What am I trying to say? Hope the results are positive when you're done with study.
Yeah, and I hope, like, I think that is the Robert Bodén in Uppsala, his main advice in the beginning was like, you do this research because it's important to ask these questions in a rigorous and like well-designed way.
Yeah.
Do not become like attached to like the positive outcomes, you know, because that can be, then it's like 4 years thrown out the window if you like devote a PhD to this and it comes out that psilocybin is not efficacious. I think it's like, it's very important to ask these questions, trying to answer them as good as we possibly can.
Yeah, I don't even know if the term positive results, to my mind, it doesn't have to mean that.
Okay.
That it works for this. I mean, whatever results you get, we're all learning as a community, right?
That's very true.
Yeah.
Yeah, that's very true.
Where can people find and follow your research? Or anything else you want to plug?
Well, they can email me if they have questions. We recently, so with UR, we did a small like episode on their series Sverige forskar, and where they did a really well produced episode of CAPC, where we talked about how, like, what we're doing, what we're looking at, and I think that's very good for like the just pop science, you know, like getting it out there and communicating our research. I think we need to become much better at that, not just like doing all this rigorous research and just producing it, writing it in a way so no one else but like researchers can understand. I think it's very important to do like reach out to everyone. So I have no channel for that, but maybe in the future.
Maybe.
Yeah.
Maybe. I saw the clip that you're talking about from UR yesterday. Very good. 5-minute clip. Very digestible, but super interesting on the study. Awesome. Thank you so much for sitting down, chatting with me.
Thank you for having me.
Much appreciated. And thanks to everyone tuning in. From the Borealis Psychedelic Science Summit in Stockholm, my name is Yoshi. Catch you next time.